Hello everyone, a very good morning to all of you. So today let's talk about a very important topic, diabetes mellitus. Okay, so I'll be taking it a bit slow so that you understand the concepts completely. It is one of the most frequently asked topic among the previous year papers. So try to understand the basics of what is happening in diabetes mellitus, and then you can apply those concepts to solve the MCQs. So before moving into the diabetes mellitus, let's talk about an important organ called as pancreas. Okay, so pancreas, it has two functions. Okay, it has exocrine and endocrine function. Endocrine means glands like hormones, right? So endocrine function of a pancreas, if you see, it will be secretion of glucagon and insulin. Okay, and endocrine function of a pancreas. Exocrine function of a pancreas, if you see, it will be secretion of digestive enzymes. Okay, so it has two functions: endo, glucagon, insulin; exo, digestive enzymes and pancreatic enzymes. Okay, so there are four cells in pancreas. Okay, pancreas is one of the very important organs that maintains the blood glucose level. Okay, either by increasing or decreasing the blood glucose level. The blood glucose level is what we call it as hyperglycemia or hypoglycemia. If it is more, the blood glucose content is more in the blood, hyperglycemia. If it is less, hypoglycemia. So these pancreas, if you see, it has four different types of cells: alpha, beta, delta cells and pp. Okay, so the alpha cells, they secrete what is called as glucagon. They increase the glucose levels. And beta cells secrete insulin, which is very important hormone pertaining to this topic, because insulin is an hormone that reduces the blood glucose. And delta cells secrete somatostatins, that is responsible for growth. Okay, somatostatins. And pp secretes pancreatic polypeptides. Pancreatic polypeptides, they regulate the GI functions. Okay, GI and digestive functions. So whenever we consume more amount of carbohydrates, the body senses and it releases insulin to control. And whenever we are in a fasting state, it needs more amount of energy, so it releases glucose into the bloodstream. This is a normal physiology what is happening. And pancreas has alpha, beta, delta and polypeptide cells, pancreatic polypeptide cells, that controls these mechanisms. Okay, so now, have you ever imagined what happens in the body when you consume a food? Okay, so in a very simple way, I am consuming carbohydrates. Okay, so the carbohydrate which I am consuming, whatever form it might be, it is broken down into glucose. Okay, it is broken down into glucose, and then it is taken up by the small intestine, which enters the blood. Okay, so these carbohydrates broken down into glucose, which enters the small intestine, and then it is entering into the bloodstream. Okay, so these glucose in the bloodstream, okay, it has to be taken up by various cells in our body to maintain the normal function. Why? Because glucose is the one that is going to give energy to the cells, right? So this blood glucose, it has to be taken or transported to the target areas, right? So it can be taken up by the cells, it can be taken up by organs. Okay, so the cells, if you see, it can reach the brain. Okay, so it can reach the brain and other cells in the body. So what is the function of an insulin, or what is the function of a glucose inside the cell? ATP production, energy is produced. Okay, and it also can enter liver and muscle, where it is stored as glycogen. Okay, where it is stored as glycogen. So A glucose enters the bloodstream. It will be taken up by cells, organs. Okay, so the cells, brain cells and other kind of cells and organs, liver and muscle, where it is stored as glycogen. Okay, now this is a normal physiology which is happening in our body. Okay, now imagine that there is some disturbances in this transport mechanism. Okay, some disturbances in this transport mechanism which is going to result in pathophysiology. And before moving that, all these functions, that is, it is taken up by the cells, it is taken up by the organs, and these functions are basically done by what is called as insulin. Okay, so insulin is responsible for these functions. So insulin, what happens, it brings certain transporters to the cell membrane. Okay, what it is called as GLUT4. So these GLUT4 are cell surface transporters that brings the glucose from the bloodstream inside the cell. Okay, any abnormality in GLUT4, the cells is not going to take up the insulin, and it is going to result in insufficient energy production, or the cells might die. Okay, so insulin function is very, very important. And also you should remember that not only the insulin function, but also the cells should be ready to take up the insulin from the bloodstream, right? Okay, now, as I told you, increased blood glucose in the blood is called as hyperglycemia. Okay, that is what we call it as diabetes mellitus. Okay, so diabetes mellitus can be of three types. Okay, one, type 1, type 2, and gestational diabetes. Okay, so type 1, if you see, there will be autoimmune destruction of beta cells of pancreas. What does the beta cells of pancreas secrete? Insulin. So there will be complete destruction of insulin, that is, there is no insulin production by the body. So there's going to be autoimmune destruction of beta cells of pancreas. Okay, so because of this, the insulin production is reduced, and there's going to be increased blood glucose levels. Okay, so what is the major complications of these patients will be diabetic ketoacidosis. Okay, this will be predominantly seen in children and adolescents. Okay, these patients lifelong they will require insulin. Okay, see, I'll be talking about the investigations treatment part in the next video. So in this video I'll talk about the basics, what happens when you consume food, what is the pathophysiology happening in a diabetes mellitus patient. Okay, so type 2 diabetes mellitus is, these patients, they will have normal insulin production. Okay, the insulin production is normal, but the cells, they do not take up the insulin. Why? We will see that. Okay, so the cells do not take up insulin. So what happens? Obviously there's going to be increased blood glucose levels in blood. Okay, so this is what is happening in type 2 diabetes mellitus. The major complications will be micro and macrovascular complications. Okay, micro and macrovascular complications. There are a few causes of type 2 diabetes mellitus. The predominant cause will be obesity. We'll see what happens. Okay, so this is type 2 diabetes mellitus. Gestational diabetes, in case of during pregnancy, hormone related insulin resistance. Okay, it is hormone related insulin resistance, and these patients will have increased risk of developing type 2 diabetes mellitus. Okay, so this is hormone related. So there are three types of diabetes mellitus: type 1, type 2, type 3. Type 1 is autoimmune destruction of beta cells of pancreas. Type 2 is, there is going to be insulin production is normal, but there is increased resistance to insulin by the cells. And gestational diabetes, the hormone related insulin resistance is going to take place. Okay, so now what actually happens in a diabetes mellitus patient? So now we are going to concentrate more on type 2 diabetes mellitus. Okay, so what actually happens is, say for example, an obese patient, the predominant cause of type 2 diabetes mellitus will be obesity. So what happens in obesity is the patient will have increased fat deposition, right? So there will be more amount of visceral fat, abdominal fat. So the obese patients will have increased visceral fat or abdominal fat. Okay, so whenever there is a visceral fat or abdominal fat, it is very bad for the body. Okay, this is very, very bad. Why? Because the visceral fat, it will secrete an enzyme called hormone sensitive lipase. Okay, hormone sensitive lipase, HSL. This hormone sensitive lipase, it is going to result in increased breakdown of fat as fatty acids. Okay, so there's going to be increased release of free fatty acids. Okay, these free fatty acids which are released by the hormone sensitive lipase, it enters the cells, that is going to result in defective or impaired insulin signaling. It is going to change the or modify the insulin signaling. Okay, so the insulin signaling is modified. So once the insulin signaling is modified, now you have to tell me, will the insulin is ready to uptake or to to take up the glucose from the blood to the cells? No. So impaired glucose uptake, and that is going to result in increased blood glucose levels. This is one of the mechanism happening in obese patients. Okay, increased visceral fat, that is abdominal fat, which is very bad. It is going to release hormone sensitive lipases, and that is going to result in free fatty acid release into the cells, and that is going to modify the insulin, because bad enemy people, they are going to modify the insulin. The insulin function is is impaired, and that is going to result in increased blood glucose levels. One. Two is, these patients, these obese patients, okay, they will have increased amount of fat, as I told you earlier. So imagine when there is a big fat tissue like this, the outermost layer of the fat, okay, the outermost layer of the fat will be hypoxic. Outermost layer will become hypoxic, obviously, because there will be it cannot supply the nutrients to all the entire big cell. So the outermost layer is going to die. Whenever there is there is some kind of a damage happening to the body, what is going to do? The inflammatory cytokines are released. So there is going to be increased release of what is called as pro-inflammatory cytokines. So whenever there is a release of pro-inflammatory cytokines, there is going to be a chronic low-grade inflammation. Okay, there is going to be chronic low-grade inflammation. We all know that the pro-inflammatory cytokines, which are nothing but interleukin 1, 6, TNF-alpha, interleukin 8, all these pro-inflammatory cytokines, they will cause chronic low-grade inflammation, which in turn is going to enter the cell, and it is going to modify, or it will cause some changes in the GLUT4 receptors. So what is GLUT4? GLUT4 is responsible for the glucose uptake into the cell. So it is impaired. So again, these patients will have increased blood glucose levels. Okay, so these are all the two very important mechanism happening in an obese patient. Okay, visceral fat, and because of chronic low grade inflammation, these patients will have increased blood glucose levels in their body. Now, the next most common thing after obesity will be decreased physical activity. Okay, decreased physical activity. So what happens when there is decreased physical activity is there is going to be decreased GLUT4 function. Okay, whenever there is a decreased physical activity, decreased GLUT4 action, and that is going to result in increased blood glucose levels. Okay, and one more thing which I forgot to tell is in obese patients, one is because of visceral fat, another one is because of chronic low-grade inflammation. And now you just imagine what I'm telling you. Imagine the body, despite of increased blood glucose, okay, the body still recognize the you are starving. Why? Because see, I am having blood glucose levels in my blood which is higher than the usual, okay, but the cells are starving. Why? Because of one of these reasons, either because of the free fatty acid modifying the the insulin receptors, or glut4 actions, whatever it may be, because of the chronic low grade inflammation. The cells are starving. So the cell is still in starvation. So what happens? It sends signals to the brain to secrete more amount of glucose. So the more amount of glucose will be secreted by the liver, and it worsens the situation. Isn't it? That is why these patients will have chronic low grade inflammation resulting in consistent hyperglycemia. So visceral fat, chronic low-grade inflammation, and because the cells are starving, it sends signals to the brain to secrete more amount of glucose, but the glucose is already increased in blood. Because of some reasons it is not taken up by the cells, and it worsens the situation. Okay, three things are happening in obesity patients. And next one will be physical activity. The third one will be any kind of genetic predisposition. Okay, so genetic predisposition, these patients will have their family history of type 2 diabetes mellitus. So these patients are highly prone for type 2 diabetes mellitus, and increased glucose uptake or food intake. Okay, so it will lead to glucotoxicity. So these are all the few causes of diabetes mellitus type 2. Okay, so what happens is, basically, now you are going to tell me, when there is increased blood glucose levels in the body, when there is increased blood glucose levels in the body, okay, it has to be transported via kidneys. So there's going to be increased glucose in urine. It's obvious, right? But the very important thing is, glucose, because of its osmotic gradient, okay, because of its osmotic gradient, it carries water along with it. Okay, so glucose alone will not be eliminated. Glucose carries water along with it because of the osmotic gradient. Okay, because of osmotic gradient. So what happens? There's going to be increased glucose plus water elimination. So these patients will have what is called as polyuria. Increased water elimination, dehydration, polydipsia. Cells are starving despite of increased blood glucose levels, polyphagia, because it signals the brain to increase the glucose production, because it is telling, okay, even though the blood glucose is in the bloodstream, I am not receiving any kind of glucose, so please feed me. So the blood, it signals the body to eat more, to consume more glucose. So what happens? Polyphagia. That is why these patients will have these three classic symptoms. Okay, polyuria, polydipsia, polyphagia. Glucose is eliminated by the kidneys because of the osmotic gradient. The glucose carries the water along with it, which results in increased urination, increased water consumption, and increased food intake. Okay, so this is the very basic pathophysiology of diabetes mellitus. Definitely, you should get used to it. In the next video, I'll be talking about very important investigations and what is the management of these patients. So, thank you so much. Have a nice day.